afternoon, everyone. I am Dr. Rashmi Chaudhary, the Senior Obstetrician and Gynaecologist in Cloudnine Hospital, Bellandur, Bangalore. I have a working experience of more than 26 years in the field of obstetrics and gynecology. My area of specialization is the management of high-risk pregnancy and the complicated gynec surgeries. Daily fetal movement count is basically the maintaining the baby's movement count in a day-to-day basis. We suggest to the patients that in an uncomplicated pregnancy, they can start counting the fetal movements from 28-30 weeks onward. They should have just before that a subconscious mind that baby is moving in the morning, afternoon and night. But in a cases of complicated pregnancy or a very precious pregnancy, we educate them to start keeping a track of the fetal movement from 26 weeks onward. Normally, a female in the first pregnancy appreciates the fetal movement for the first time around 20 weeks of pregnancy. In cases who have a previous one delivery or two deliveries, they can appreciate around 18 weeks. This fetal movement appreciation is called quickening. So, in the 20 to 24, 26 weeks, the fetal movements are very erratic. Sometimes you will feel in the morning, sometimes in the evening, sometimes entire day you might not feel. So people come with panic that doctor, I have not felt any fetal movements. So you should not be panicked. You just come and get it checked by the doctor. Mostly it is fine only. Why we give so much emphasis to the fetal movement? Because this is the best way to assess the health status of your unborn child. If the duration of pregnancy is more than 26 weeks and 26 weeks onward, you should keep a track of your fetal movement. There are different ways of doing that. What I advise to all my patients that after each meal they should keep a track of the baby's movement, how many times baby is moving. Baby is more active, more brisk movements are there once you eat and your blood sugar level rises after eating, and baby gets also more glucose and their movements are very brisk after that. So after eating you should walk for 10-15 minutes. Be comfortable and then you should lie down on the bed, preferably in the lateral position, any side, right or left, and you should keep hands on your tummy and then keep a track of your fetal movements. In 1 hour, how many times baby has moved. If in 1 hour baby has moved about 5-6 times, there is nothing to worry. And some of these 3 hours after breakfast, after lunch or after dinner should be more than 15 to 20. If it is happening, there is nothing to worry. If it is less than 3 in 1 hour, you should be reporting back to your gynecologist. If 1 hour time you are not able to, you thought that okay, I will observe in 2 to 3 hours time and you are not able to appreciate, wait for 1 hour, have some more sweet and hot drinks and you can appreciate. If it is again not moving, then immediately go to the hospital for the checkup where they will do the ultrasound and the non-stress test. Sometimes patients they get confused what kind of movement we should take here. Is it a kick or a rolling? So normally any movement which is either is a brisk movement or a rolling movement or a flutter movement or cups, you should consider as a movement. There is another way of keeping a count that some schools of thoughts they say that if baby has moved for 10 times in 2 hours time, then you stop counting. That's good enough. So whichever way, in a subconscious mind, you just keep a track that your baby has moved in the morning, afternoon or night. All the babies will have some pattern, regular pattern for the movement. If any deviation from the normal, go back to the hospital.